Just a quick note to those in the audience. If you do want to sign up to speak to a bill, we have a sign-up sheet over to the side there. So if you are planning to speak, make sure to sign up on the sign-in sheet there. Thank you. We'll get started in a second. All right. Well, good afternoon. We're going to go ahead and get started. The Policy Subcommittee of the Education Committee. Before we get started, I would like to have Brent, if you would open us up, Representative Cox, in a quick word of prayer.
Okay, let's pray. God, we thank you for today, and thank you for you just being here with each one of us, and we ask for your guidance in all that we do, and may the choices that we make and policies that are created honor you, and we trust you in all of it. In Christ's name, amen.
Thank you, Representative. One other thing I'd like to ask is, do we have any educators, teachers, former teachers in the room? If you would stand up so we can recognize you. We got a whole row of them there. Awesome. Thank you. We love our educators. There's no better time of day for my wife when she drops our kids off at school. So thank you for what you all do. With that, I think I saw Chairman Perkle in the back there. I will call you up to the podium to present House Bill 51. 51. Yeah. Mr. Chairman?
Ready? There's a lady that came in late that wanted to speak to the bill. I didn't know if
We'll get her signed in.
So.
Thank you.
So thank you, Mr. Chairman. Can y'all hear me okay? How about this? A little bit closer? I bring before you for consideration House Bill 51. This is LC 49, 1192S. LC 49, 1192S. This particular bill provides school systems with added flexibility of transporting students. The genesis, so, I mean, we always want to know, where's this come from? You know, where did this come from? You're not a teacher? No. I'm a farmer. But I listened to my school system, and I had one of my school systems call me up, and they were concerned about the inefficiencies they had in some of the transportation of kids to school-related activities. For instance, taking an FBLA student from South Georgia to Atlanta for competition on a bus with a CDL driver, which is difficult to find at times. And we had the General Assembly a couple of years ago. I don't know if it's Chairman Dubnik that carried the bill, but allowed for the transport of students if they were IEP special ed or homeless students in something other than the school buses, provided for the State Department of Education to enact rules for the transport vehicles, what size, who could do it, etc. So, as currently written in Georgia Code, the ability to transport students in anything but a school bus is limited to students with an IEP or to homeless students. I'm not saying that school systems don't do this. I'm saying in current code, the only way that you can transport, as Leg Council told me, is these two classes. So Section 1, if you will, turn with me. It allows the school board to transport students, not just IEP students, in a vehicle other than a school bus, if they choose to. There again, flexibility is line 15, it says may. So if they choose to, they have the option. Notice also Section B, which begins on line 23. This is currently in code, so those of you who are here when we enacted this a few years ago, this will be overkill for you because you already read this, but it provides that the State Board of Education is responsible for establishing the minimum standards for these vehicles, minimum qualifications for these drivers. It also provides on lines 28, 29 that the local Board of Education may establish requirements in addition to the state minimum requirements. There again, it's more control for your local system. And for Section 2, I'm sure you're all aware that schools can only spend school resources on authorized use of funds. So the law is currently silent on whether you can use school resources for insurance on non-school bus transportation vehicles, and this provides the authorization to do so. And there again, the limits are established locally. So this is a way that we can provide flexibility for our local school systems and the transport of kids to and from school-related activities. So that's the bill. I'll stand for questions, if that is okay, Mr. Chairman.
It is. Thank you, Mr. Chairman. I'll remind folks on the committee, this is a hearing only, but I really want us to take the time to dig in, ask the chair questions about the bill, and roll up the sleeves and get to understand it and see what questions y'all have. So with that, I'll open it up to questions. Representative.
Thank you, Mr. Chairman. In practice now, I believe that some districts may be using non-school buses, quite possibly.
I'm quite certain that they are.
Does the DOT standards now reflect the reality of the vehicle safety, or is it more tied to code? Could anybody answer that? Like the DOE policy on school bus safety, does it reflect the fact that people are actually using less than school buses?
That's something that you'll need to ask the Department of Education.
Okay.
So the DOT has different
The
standards.
DOE, I mean, yeah.
Yeah, the DOE actually came up with standards for when we passed this legislation, and someone can help me out that knows more than I do. Seems like it was a couple of sessions ago. I'm seeing blank stares. I mean, y'all been on this committee. Wasn't it a couple of years ago?
Yeah.
And so they did come up, promulgate some rules. So
Okay,
Yes.
I'll reach out to DOE. I was just curious because I know, yeah, I would say that they are using it, especially for activities where you're bringing athletes to the Capitol or something, or a local event where you only need 4 or 5 people. I think they're running something else besides school buses.
I don't doubt that. Absolutely. So I was in school so much earlier than most of y'all on this panel. We would get in the back of a pickup truck and go down to the FFA farm. Not that they should have, but I'm sure we've done things in the past that were not authorized in code. And this is basically to bring flexibility. So one of my school systems was just frustrated. It's a small school system, and if I have 2 members of a poultry judging team, can I, take them to a poultry judging contest, and the Suburban or whatever would suffice, and I told him, I said, I think you can already do that. And when I checked with legal counsel, it turns out you really can't. It's not authorized. So.
All right, thank you, Mr. Chairman. It's right after lunch. You're probably going to see a lot of blank stares. We'll try to wake up this committee. Representative Maynor with a question.
Thank you, Chair. We did talk about this, I think, last year in committee, and one of the things that we talked about was the school buses at, let's just say, railroad intersections, and how they have the lighting just saying, hey, there are children on board. If we're allowing, one of the questions that came up last year was if we're allowing other forms of transportation besides the school buses, do you foresee these being marked as we're carrying children on behalf of the schools?
There again, I would hold that to the locals. So the locals will provide. The State Board of Education should provide the framework. Okay, so it should the vehicle should weigh this. It should perform this on a crash safety rating. The driver should follow these procedures. But there again, I think signage, those things I think are best left up to the local school system. I know, so I actually have a CDL with a passenger endorsement. And now every school system in the room is going to try and get me to drive a school bus for them tomorrow morning. But I know you stop at every single railroad crossing. I mean, that's what you do. That's not required for this morning, and when I drove in my pickup truck, I did not stop at each railroad crossing. But those are things that are up to the purview of the Department of Education and the local school system, I think.
If I could have a follow-up question.
Yes.
What's so interesting about being up here is being in a rural community is so much different than being in an urban community. So I can definitely see how this may benefit a rural community. But to just also point out for the differences in different populations across the state of Georgia, the transportation of our children is so important. And if you watch the news in local districts, transportation can sometimes be violent for kids. And so how we're transporting children back and forth is definitely a concern of mine. But the other thing that I would think, if there are not a lot of children on the school buses, and that's the reason you're bringing this bill, then what comes to mind is also just saving gas and less emissions from the buses if we're transporting people more efficiently. That's it. Thank you.
I agree. Thank you.
Thank you, Representative. And yeah, just for those in the audience, so my crack staff here, it was Senate Bill 159, I think, that was passed during the 21-22 session that dealt with this subject. I think was maybe what you were referring to.
Who carried that bill?
Gooch.
Okay. But not on our side, though.
A bar in the House.
Okay.
Yep.
Bar.
Yep.
Thank you.
Representative Glaze with a question to my right.
Thank you, Chair. I'd like to ask more about notice with parents. If we're not using a school bus, would it be considered to make sure that parents have notice that students are being transported in a vehicle that is not a school regulated or not a school bus? Because sometimes we have the shorter buses and the long buses. I was a former key student advisor to our Key Club, and we had to use shorter buses and sometimes different vehicles to take them around the state to different activities. So I certainly know when there's smaller school systems how important this can be. But I certainly also had the option, I was required to give parents notice if we were not using the school bus, whether it was the short one or the long one. And I wondered if that was important, or if you thought we could put that in here as just a friendly amendment.
So I think it is important. I think a lot of problems in marriage, in school systems, is communication. I think perhaps, I know my wife would probably echo those sentiments, that if we communicated more, then we don't get on the different pages often. So yes, I think it would be wonderful if we communicate with the parents more. We don't get authorization when you ride a school bus. But if it's something other than school bus, I think the whole purpose behind this bill is to provide flexibility for the local school system, so that they would have these rules. Department of Education will have, the State Department will provide the broad framework, but it should be tailored. And I'd hate to put it in legislation that requires you to do this at each and every time, but to have flexibility, which is the whole reason for bringing this. This is not a, this is not a department bill. This is just from, and I got to tell you, so the bill HB 51, one of my superintendents sent me a text the other day. He said, "Clay, look here, buddy. Oh, that was my high school number. I think it's gonna bring you luck." He really liked this bill, and I had every single school system that I taught with, that I represent, was highly complimentary of this, and I really like it because it does give them flexibility. There's no mandate in here. You do not have to. So for the rural urban divide and differences, and we certainly have differences in Turner County versus Fulton County or DeKalb County, Cobb County. There are differences, and I think that's what makes it great, that we can provide flexibility for that. So thank you for the question.
Thank you, Mr. Chairman. If I've learned anything down here, you need luck, God, and the speaker. Probably in that order. All right, Chairman Jones, to my left.
Thank you, Chairman Hilton. First of all, it's great to just have a Georgia Tech graduate presenting this as opposed to an ARS graduate. The real quick to the question to...
I just lost 10 votes on this panel.
No,
Thank
you
you,
didn't.
Mr.
It's
Chair.
hearing only, hearing only.
Yeah, it's hearing only. They will forget. To the previous question on line 21, at the very end it says marked for the transportation of school children to and from, which led me to believe that they would either have permanent affixed signs or maybe magnets, or I'm assuming the districts that want to take this option, like you said, it's not mandatory, they would, I'll say, come up with some means to be able to notify and obviously make it clear that either down State Road 141 in Forsyth County or down in Tifton that they are transporting children. My question to you, sir, is this: did you mean for that to be may after the and, or did you mean for that to be shall? And the reason I'm asking is, since line 20, the end of it starts with such vehicles may include 8 and less, and then it says and mark for transportation. I wasn't sure if you intended the markings to be a shall or a may, and I thought since this is a hearing only, we could work together and see if we need to maybe do a little bit of verbiage change. The silence is killing me. Yeah,
Yeah.
but
And
it is from last.
it is, yeah.
And I think I think the
And
comment that the gentlelady from my right said, we may want to just consider, Chairman Perkle, do we want to make that where it is mandatory that if you are going to take this option up, maybe there should be, again, it could be a magnetic sign. You know, I'm not talking about permanently affixing things to a van or things like that, but maybe to just make sure that there's notice that we're transporting children in that van or in some capacity vehicle. Okay.
Well, thank you.
Thank you.
Mhm.
Thank you, Chairman Jones. Let's go to Representative Paris down front for a question.
Thank you, Chairman. Thank you, Chairman Perkle, for bringing this because I live in an urban area, and there is a need for transportation, even outside of like public school. We have charter schools that, you know, that's one of the reasons why charter schools are having some trouble in some areas because people can't get their kids there. So on that note, I am somewhat for the bill, but also on the school buses that the state has, they have cameras. They have so that they can monitor behavior on the buses. And you know, here lately in the news, we've seen some horrible things that have been happening on buses, and I think that that would probably be something that I would like to see on it as well. Some type of monitor on the bus, camera on the bus that kind of keeps people somewhat in check. I mean, we've seen that, well, I'm not going to say that. But anyway, that's my comment.
Yeah, I've seen some of those reports, and it is troubling. I would ascertain that it's a lot easier to find a problem, a discipline problem, with an 8-passenger or less vehicle. I mean, it's right here, rather than one that's, I don't know how long a school bus is, but, you know, pretty doggone long. And if something happens in the back and you have, you know, 70 kids on the bus, it's a lot more difficult to, I would think, to address the problems than it is when, you know, mama could go into church, could straighten out because they're right here. And
That was
not
a
that
long
they
time
would,
ago.
not that mama would be driving this, but it's, the point is because they are closer. It is not, you know, you don't have 50 feet between the driver and a potential problem. So
Right. If I may go, just
One more.
Just
Yep.
one more.
Thank
Thank you. I understand what you're saying, and that's very true. But while a person is driving and having to be in the rear as well is
Right.
difficult. An ounce of prevention is worth a pound of cure. One incident is one incident too much.
it's,
And so we're just living in a different day and time.
Mhm.
And I think that we really have to make sure that the kids are okay. And that's my thing. Thank you.
and I do follow your remarks. And there again, these are some of the rules that the local board would and could and should promulgate.
Thank you, Mr. Chairman. We got one more question here from Representative Cox. Am I right?
Thanks for bringing this bill. Coaching and teaching up in North Georgia, I know a lot of times when we would have a tennis team that needed to travel up to Blue Ridge or somewhere to play in a game or have a match, it's very important that we have these type of vehicles to be able to transport them for sure. I know that the local Board of Ed, we actually had a smaller bus or smaller community van that we basically used, which was helpful. And at the same time, we always had a coach or whoever was overseeing that activity was also on that bus or that small vehicle. So I just want to say from North Georgia, this is a great thing. It's helpful. It's safer driving through the mountains. If you've been on a bus going to Blairsville, that's a whole different ride on a yellow bus than this, but thank you for doing this.
I actually have, and you are correct.
Thank you, Mr. Chairman, for bringing this bill to our committee. We've got one more question. It looks like Representative Evans to my right.
Thank you, Mr. Vice Chair. Thank you, Chairman Perkle. I've just kind of been consulting with Representative Glaze here, and I did want to ask for your consideration about including something about, or I'm welcome a dialogue, but notice should notice be provided to parents that whatever kind of vehicle they're using. That's I think that would be a consideration. I'm remembering years and years ago, many times communities used like the vans that would topple. I know we had like after school programs, I mean, not that a school would ever want to do that, but you just want to make sure parents know what type of vehicle that their children are being transported in. So I would ask for a friendly amendment to consider parental notification in there.
Thank you, Representative Evans, and thank you, Chairman Perkle, for bringing this. As you mentioned, we live in a very large and diverse state, and giving our school systems flexibility is an important thing. So I think we've asked some good questions today. You've gotten some good suggestions, and hopefully we can make a few edits and get it back to full committee here consideration. So
Thank you, Dan.
Thank you. Yes, sir. I don't have anyone on the sign-up sheet to speak to the bill. I know we've had a few people come in late here. Does anyone in the audience want to speak a couple minutes to the bill? I see a hand there. Yes, ma'am.
Yes, hello everyone, Mr. Chairman, committee. Thank you for this time. My name is Erica Long. I work with Atlanta Public Schools. We are very much excited about this potential flexibility for transportation. It's not just a rural issue, it's also a metro issue as well. We don't have a distance problem in Atlanta, but we have a traffic problem. So the idea of being able to take smaller groups of students, say a robotics team or a debate team, from one part of the city to another in a smaller vehicle than that yellow bus would mean a lot to us and our parents. Thank you.
Great, thank you. One last chance. Anyone in the audience want to speak in favor or opposition? All right, great. Seeing none. This is hearing only, as I said to the start, so we won't need to entertain a motion at this time. But again, want to thank Chairman Perkle for bringing this bill to committee here. With that, we'll move to our second hearing only. Representative Maynor, if you would make your way to the podium, we will hear your comments on House Bill 141. Before Representative Maynor starts here, I just want to share, this is a subject that's near and dear, unfortunately, to a lot of our hearts, and we've talked a lot about mental health and the importance of addressing it here at the Capitol. Chairman Jones to my left here and others, Mary Margaret Oliver, have done a lot, but there's still so much more that needs to be done. I was doing some research on this bill, and you may correct me if I'm wrong, but it looks like suicide is the second leading cause of death for minors in Georgia. DOE has a study on their website. They survey students, and I was shocked to see over 10% have contemplated suicide at one time or another. So it's a scourge. It's something that needs to be addressed, and I'm grateful for you bringing this to our attention, and look forward to a healthy dialogue here on our committee as we work through this bill.
Thank you, Chair. I'm trying to give myself some room to.
I can keep talking if you like. I can filibuster all you need.
Okay, thank you.
And I'm reading from, I've got LC 491102.
Yes, that's correct.
You've got the floor.
Thank you, Chair, and good afternoon, committee members. We had this bill last year, and it's the exact same wording from last year. We had a committee meeting. I did not change anything. Interesting thing is I was going to just drop this bill for awareness only, but it turns out this is such an important matter that the media, several people contacted me and are happy about the bill. I believe some people have signed up for the bill, I spoke to one of the chief lobbyists with GAE. He'll speak about some statistics in regards to suicide prevention. One of his suggestions was that in the bill on line 12, it says doing the screenings at the beginning of the year. His concern was the beginning of the year is so hectic and children or students in schools are already doing so much. But at the same breath, someone could die in October. So just thinking about that as well. This comes from Code Section 37-1-27. So already in code, we've already worked on screening tools and a state suicide prevention bill. I would say that, interesting enough, it says it was last updated in 2010. So it mentions 850 die by suicide every year, but that number since 2010 has drastically increased. And I'm going to quote you some stats from NAMI, the National Alliance of Mental Illness, the Georgia chapter. And 1,405,000 adults in Georgia have a mental health condition. 1 in 6 of U.S. youth aged 6 to 17 have a mental health disorder. 104,000 Georgians aged 12 to 17 have depression. High school students with depression are more than 2 times more likely to drop out. On average, one person in the U.S. dies by suicide every 11 minutes, which means a few minutes ago someone died. Actually 2, because we've been in here more than 22 minutes. In Georgia, 1,569 lives were lost to suicide. More than half of people with a mental health condition in the U.S. did not receive any treatment. 4,911,327 people in Georgia live in communities that do not have enough mental health professionals. 1 in 4 people with a serious mental health illness has been arrested by the police at some point in their lifetime. This leads to over 2 million jail bookings. That's really important because we're talking about youth, and if we're not catching youth now, these jail bookings later. Some of them anyway. About 2 in 5 adults in jail have a history of mental illness. 7 in 10, so that means only 1 in 3 are not. So 7 in 10 youth in juvenile justice system have a mental health condition. This paper does not like highlights. Okay, so they came out with some, and this is NAMI, they came out with some early intervention and prevention talking points and suggestions. One is early identification and prevention efforts can alleviate suffering of young people and their families. Early intervention is proven to be clinically effective and to reduce aggregate healthcare costs. I'm going to go to another fact from them. Georgia's youth are in urgent need of comprehensive mental health and substance use services. Prior to the pandemic, Georgia's youth was already struggling with mental illness and substance misuse. COVID-19 exacerbated that. 30% of Georgia high school students reported feeling sad, hopeless, and nearly 12% seriously considered attempting suicide. Most suicide screening bills, you guys may have heard of a depression screening scale. I know that the primary health physicians right now, they're trying to not make it mandatory, but they're trying to make sure that just even adults are being screened for depression. And these are 5-question surveys. Have you felt sad in the past 2 days? Are you staying away from friends and family? So they're not questions that you would think would promote you to be depressed or promote you to harm yourself. But these suicide screening skills are really about, are you depressed, right? And so According to the CDC, youth and young adults have experienced the highest increases in mental illness and substance misuse and substance use disorder claims are up for 13 to 18-year-olds nationally. 50% of mental health conditions begin by age 14 and 75% begin by age 24. 10% of children and young people age 5 to 16 have a clinically diagnosable mental problem. Yet 70% of children and adolescents who experience mental health problems have not had an appropriate intervention. What they ask is expand gatekeeper training for school personnel and a universal prevention activities. Expand the IRT, which is Screening Brief Intervention Referral Treatment Efforts. That would be a suicide screening. Also implement statewide trauma-informed training for staff in all settings and implement evidence-based mental health substance abuse screenings. I have one other fact that I want to go by, and these are specifically related to children in 6th through 12th grade. So for 6th graders, 1 in 3 experienced a drastic change in behavior and or personality 1 or more times in the past 30 days. 7th graders, 1 in 5 avoided food, threw up, or used laxatives to lose weight 1 or more times in the past 30 days. 8th graders, 3 in 10 experienced extreme difficulty concentrating or staying still that put them in physical danger and or caused school failure 1 or more times in the last 30 days. 9th graders, you guys are looking at me like, what? But these are some serious statistics. And so I like that they have broken this down by grades. 9th graders, 1 in 2 experience intense anxiety, worries, or fears that get in the way of their daily activities 1 or more times in the past 30 days. 10th graders, 1 in 10 harmed themselves on purpose 1 or more times in the past 12 months. 1 in 11th graders, 1 in 8 considered attempting suicide 1 or more times in the past 12 months. And for 12th graders, 3 in 5 felt sad, depressed, or withdrawn 1 or more times in the past 30 days. When children are dying by suicide, oftentimes families have no idea that their child is depressed. I've said here in a previous committee, my little brother died by suicide. And the number one thing that we said, who knew? Smart kid, sociable, friends, absolutely no idea. When you hear kids or families on the news, everybody says, I had no idea. There are going to be some exceptions where the child has been getting mental health treatment for different reasons, but there's a whole other category out there that are just living their lives, and no one is aware. None of his friends were aware. For the early identification and prevention, the negative effects of failing to identify and address behavioral health challenges manifest themselves over a person's lifetime in terms of physical and mental illnesses and substance abuse disorders. Early intervention, I said this earlier, is proven to be clinically effective and to reduce aggregate healthcare costs. This is a survey from Vox, and I thought that this was kind of interesting. This is what do teens have to say? This is a survey from the teens. The question was asked, the top 3 topics that teens selected as the most important to them. Number 3, mental health, 43%. Another question, what makes an after-school program a quality experience in your opinion? 1, feeling like they belong, and 2, a no judgment zone. Those are all things about your mental health. You want to feel like you belong, and you don't want people to judge you. During a typical school week, what do you do after school? 60% say, I just go home. Preventing suicide questions. Do you know anyone who has thought about suicide? 49% yes. Have you ever thought about suicide? 34% yes. Stress levels. What is your average daily level of stress? 37% high, 17% extremely high. This particular survey was conducted over several years. Those numbers have increasingly gone up each year. Another one is, what helps you alleviate stress? 33% said talking to friends. Do you know teens who talk openly about mental health amongst themselves? 59%. One real problem with that, it's great that kids are talking about it amongst their friends, but we need kids to be talking to a mental health professional that they're feeling this way. Where do you get information about mental health? 44% online. Is that a great place to get mental health information for a child? It's not, if you did not know that. So this is from the American Foundation for Suicide Prevention, Georgia's Voice. This picture is the face of 8 people that have died by suicide. When you pass by suicide, it doesn't matter your socioeconomic status, it doesn't matter your education, it doesn't matter if it's rural or urban, gender, religious group, it just doesn't matter. I am in the belief that preventing one person from dying by suicide is just as important as preventing 1,000 deaths, especially if it could be prevented. Suicide is the 10th leading cause of death. There are usually 25 attempts for every suicide deaths. There are up to 200 attempts for every one youth suicide. Suicide costs the U.S. $44 billion annually. In Georgia, over the 10-year period, firearms were the mechanism used for 6,308 of 10,000 plus suicide deaths, and that was compared to nationally. And so Georgia has more deaths by suicide than national statistics at 61.7% compared to 51%. Suicide cost Georgia $1.3 billion of combined lifetime medical and work loss cost. And I am open to any questions.
Thank you, Representative Maynard, for your presentation. I will open it up to the committee now for any discussion. Representative Maynard, you have a question from my right. Representative Evans.
Thank you, Mr. Vice Chair, and thank you for bringing this bill. Can you tell us a little bit more about what that screening might look like, or would it be different for different age groups? Or I'm remembering last year you maybe had handouts about that. So can you talk a little bit more about that?
Yes, so normally the screening tools are age specific, and within the current code, DBHDD, I feel like I always get that wrong, but DBHDD, within 37110, I believe, they already have the suicide prevention plan where they came together, and it can be the screening tools that they are already using that are age specific.
You have a follow-up question?
Yes.
So this would be like a pen and paper test, or a verbal test, or a online test screening, or what or would it be by a teacher? Would it be by a school nurse, or how would that be administered, do we think?
So normally these tests are about 5 questions. Some of the questions are, have you felt lonely or depressed in the past 3 days? Are you feeling like you do not want to participate in activities outside of the home? Who would offer the test, normally it would be each school, and somebody I think is going to testify to this, but normally schools have crisis intervention plans where they have social workers or the nurse or a school counselor that can give this test. If you were to, it's the same test that they do in the emergency room. So if a parent were to go to the emergency room and say, my child is feeling X, Y, and Z, they would pull out a questionnaire that's about 5 questions, and that kind of leads them into what track they need to be in. I do understand that we do have a funding problem, especially in rural Georgia. Some communities don't have a social worker. Some communities don't have a counselor. And so that is an issue. So one of the questions I posed was to the GAE is the communities that don't have these services, is telehealth an option? But the other person that it could be, since it's just 5 questions, there could be designated school personnel that could work with the DBHDD to formulate who in the school can identify these questions. You're not interpreting anything with the 5 questions if you answer so many yeses compared to so many nos. So if it is 5 questions, if you answer 3 versus 2, or 4 versus 1, that puts you in a category of risk or no risk. And that's when you would be identified to a more appropriate mental health professional for more guidance on the next steps.
Thank you, Representative. I think I saw my chair. Chair Irwin, did you have a question?
Yes, sir. Yes, sir.
I'm pushing it. I don't got it yet.
Better?
There we go.
There we go.
There we go.
Thank you, Mr. Chair. The first of all, Representative Maynard, thank you for bringing this. Thank you for your courage. I have working to try to help our citizens in this state with any mental health issues is greatly appreciated and a passion of mine. So much so that I remember a couple of weeks ago that Chairman Jones, sitting in the well, talked about after the fine bill that we passed last year that he wrote that this needs to be the decade by which we help our citizens with the mental health issues that we are encountering today. So thank you with that at your efforts here. I want to point out on line 16, at the very end of line 16, refer any students. What I'd ask of you, have you thought any of how difficult that can be, that conversation with parents, if you are referring that child, especially one that you love dearly in your classroom, and how the parents are going to respond and how we should really refer those children?
So it would have to be someone that is trained to do the actual referral. I can say, speaking to the counselors just down the street at Wesley International, the closest school to the Capitol, is there are different responses to parents when the school identifies a child that is at risk, especially at risk for harming themselves. And the responses are, we really do think that, well, the school will say, we really do think that you should take your child to the emergency room, XYZ. Parents can either take that information and take their child to the emergency room or not. And what they have told me is there are parents that are so engaged where even if their child ends up not being at risk, they would never want to take the chance of their child dying. But then there are some that it's like how people don't go to the doctor, right? Because you're afraid of what the doctor might say. And so there are parents that will not take the advice of a professional. And all this bill is trying to do is give a family the information. But it truly is up to the parent if they're going to use the information.
Okay. Hey, Mr. Chair, I'm going to recognize, looks like she waved. Vice Chair Ballard, did you have a question? The chairman stole me. He stole your question. Love it. Representative Daniel with a question.
So mine actually pertains to his question as well. So same line, the last part of 16, it says local school systems shall refer any students as appropriate to mental health services or programs based on the results of the screenings. Does this bill only pertain to suicide, or will they be referred for other mental health issues as well? So is this screening going to screen for anxiety or, some other type of mental health disorder? And if that is the case, I do think you run into, do we have the parents' permission to do that? And I say that because my daughter has a speech impediment. And one of the things that we had to do, we actually had to sign over for her to be evaluated for everything in order to get her speech therapy services. You don't want me talking anymore? We had to sign over that they could check her for everything. So, something as simple as speech therapy that was required. So I just want to make sure, because I do think this is a good initiative that you're trying to do. But if we're going to put it forward, we've got to make sure that those bases are covered.
I think that's a great question. This is meant to prevent suicide. I think it would be a much larger issue, even though depression and anxiety and other mental health conditions are important. This is about saving a life, so it is not necessarily about screening someone if they have anorexia. It really is just for suicide prevention, because the suicide prevention screening is not the same as, do you have anorexia? Do you have a speech impairment?
Right. Okay. And then another question, if that's okay, Scott. Is there a reason that you want it to start at 8 years old? That seems very young. I would hate to, introduce a thought that's not there currently.
Right. So the suicide screenings do not mention the word suicide when they're asking the questions. They're age appropriate. The American Pediatric Association has a suicide screening tool that DBHDD may use if they wish to. But right now I have another bill out because in inpatient pediatric facilities, psychiatric facilities, children are admitted as young as 5 and 6 years old. And so 8 is not the bare minimum that's receiving these services. So the thought is, if it is the leading cause of death, we need to be catching them before the manifestation of actual suicide attempt. One of the statistics I mentioned was, I think it was before a child actually commits suicide, they have thought about it at least 200 times. And so it might start at 5 or 6,
Right.
It might start at 8. We definitely don't need to push it back if we have children in these inpatient psychiatric facilities as young as 5.
Right. Are pediatricians currently doing these screenings?
Only if the parent is coming to them saying, we have an issue.
Okay. Thank you.
Thank you, Representative. We're going to recognize Representative Paris up to my front here.
Thank you, Chairman. Representative, I think we looked at this last year, correct? I have some concerns about it. I appreciate the information that you've given us, and it did kind of clear up some of the cloudiness that I'm having about it. But I really feel like on line 11, it says, beginning in the 23-24 school year, each local school system shall require every student age 8 through 18 to undergo a suicide screening at the beginning of each school year. That says every student. That's not just ones that are showing signs. That's every student is coming through the door. That to me is a concern. You know, there was a show Netflix had, 13 Reasons Why, and the National Institute of Health says that the suicide rate amongst teens spiked about 18 to 20% once the show started to evolve. I know suicide is a problem. It's something that I really feel very sad about when I hear about it, and my deepest condolences to you. I just think that making this something mandatory for every child is going a bit too far, is a little bit too far-reaching, and that while it may be necessary, some of this may be, to go and to have to test every child is just maybe putting poison where it may not need to be. Can you respond to that?
Yes, I do. Thank you. So again, if you can refer to OCGA 37-127, there's already a suicide prevention program in place, and that program says you have to have permission from the parents. And so each parent has the ability to opt in or opt out. That choice is given to every student. I'm going to read from OCGA 37-127. But before I do that, she mentioned, do physicians screen for this? All children don't go to the doctor. So that's one issue. And the 13 reasons, my daughter, my oldest daughter, who's now a senior, she was in middle school when that came out. We were living in Sandy Springs, and 13 Reasons, it was really horrific for the community, but that's also entertainment. That was a show versus 5 questions given by a professional that does not mention the word suicide. But going back to OCGA 37-127, the General Assembly makes the following findings. Every year in Georgia, X number of people die by suicide. I'm not saying the number because it's from 2010. More Georgians die from suicide than homicide. More teenagers and young adults die from suicide than cancer, heart disease, AIDS, birth defects, stroke, pneumonia, the flu, and chronic lung diseases. Many who attempt suicide do not seek professional help. Education is necessary to inform the public about the causes of suicide and the early intervention programs available. There is created by this statute the Suicide Prevention Program to be managed by the department, which is DBHDD. And so the program that they already have established, it's just not in cooperation with the school systems right now.
So just one follow-up. Thank you, sir. So what is the current protocol? Are schools across Georgia in compliance with this code, section 37-127, or what is going on?
So the current code, which was done in 2010, did not incorporate schools. So it's only incorporated within the services that they currently provide. There is not they have not done the suicide prevention program with the school systems as of yet.
Okay, all right, thank you.
Great.
Thank you.
Thank you, Representative.
Thank you, sir.
And what I'm going to do too, I'm going to take one more question from the committee. We're near the top of the hour, and we got a couple folks from the audience that want to speak to the bill. Representative Wilkinson, if you'd ask your question, then if it's okay with the committee, we'll take questions after our testimony.
Thank you. Thank you, Mr. Chair.
You're good.
Thank you, Mr. Chairman. Mr. Chairman.
Stop pushing the button.
All right.
There we go.
I've got it loose. Thank you, Mr. Chairman. Thank you for the bill. I guess for me, I would add on to line 16 is if we could clearly identify who the appropriate personnel would be to communicate this. Because I think as you go through these screenings, we want to make sure, one, that we're communicating to the parents effectively. Two, I want to make sure that we don't open up our teachers to any liability, such as, mandated reporting, that if they do hear something, they've been then forced to interact in other ways, because I know we have mandated reporting requirements. So if we could just kind of look at those areas, I think that would be helpful, along with the capacity of being able to do it. So thank you.
Thank you.
Again, thank you, Representative Maynor. This is such an important subject here, and clearly there's an interest on the committee, and so let's continue to work together to find a good solution for our students and families.
Thank you, Chair.
With that, I've got two folks signed up to speak to the bill, Joe Fleming and Mary Clausen, if you'd start to make your way. And if we could try to keep our comments to 2 or 3 minutes, that would be awesome if we can.
Thank you again to Ms. Maynor for bringing attention to this subject. Obviously, it's tragic to think about and know that suicide happens amongst our kids. One of the things that we have at our resource, though, that I want to mention just briefly, are school counselors and social workers. The problem in Georgia is that we have an obscenely high ratio student to social worker. For example, we have one social worker for every 5,272 students. We have one school psychologist for every 6,390 students. So there is an opportunity, and maybe we missed a great opportunity with Mr. Jones and Speaker Ralston's bill last year, but there's a great opportunity to fund some of those. State funds about 15% of those costs right now. So the costs are being borne by school districts where they have them. And I know of school districts in Georgia, particularly rural Georgia, where there is one school psychologist for the entire school system. So as part of her presentation, I just want to bring attention to the really high ratios of those kind of folks who could be particularly helpful in this, and hope that at some point we can find funding to decrease those ratios and increase the number of professionals that have experience in mental health. Thank you.
Perfect. Thank you, Mr. Fleming. With that, we have Mary Clausen with Protect Student Health here to speak to the bill.
Thank you, Honorable legislators on the Education Policy Subcommittee. My name is Mary Clausen. I'm a family nurse practitioner, a mom, and I volunteer with an organization called Protect Student Health Georgia. And we kind of take a mile-high look at what is the healthiest, safest things for kids in our schools, in our state. We do not believe that screening kids for suicide mandatory is going to be helpful for the kids. The article I just gave you is a social-emotional learning article. It's like 50 pages long. I'll send you the link. But it talks about one particular screening survey called Teen Screen. Actually showed 85% false positives. And so it sent kids for treatment. For every 14 kids that really needed treatment, 85% got sent to treatment. So it's dangerous to identify kids that may not need treatment. The individuals doing the screenings are going to be inadequately trained. 5 questions is just a little blurb on the screen of a child. You don't know how they're doing over the course of time. The parents need to be involved with the kids. And I think we could lower our suicide rates if we had higher, less students per teacher. If every kid was in a classroom, there's only 15 or 20 kids in a classroom with one great teacher that loved them, I think suicide would be minimal in our country. And also if more parents could have more time with their kids, I think suicide would be minimal. Misdiagnoses are key, and what we worry about is that when someone gets diagnosed with a high-risk issue, the dad's going to be flagged, and kids are starting to get so much data collected on them with SEL that the government is really building a womb-to-tomb data system on our kids. And so kids that get flagged are probably, it's not going to be for their benefit. The Vox survey, Representative Mayor, that you talked about, Vox is not reputable data, scientific. It is just questionnaires they put out for certain groups of kids that happen to be on their websites. My children do not look at Vox, so they would not qualify for this study at all. To prove that something is really helpful, you take a screening, you give it a certain amount of kids in a wide variety of areas, and then you follow them several years later and see if this was helpful or not helpful. So kids saying that they feel sad and lonely, it is a big issue for our children, but what we have to do is talk to them, and they need to be referred back to their parents. Middle school adolescent boys will not take this serious, and that's, and again, in the study, it shows you how middle school boys just take goofy answers. They try to get a rise out of people, but once they do make those scores, their data is going into the dossier that's being collected on them. Screening young children is preposterous. Young children do not have the cognitive ability to accurately assess themselves to answer those questionnaires. Pediatricians and psychiatrists assess children and teens in many ways. The simple screening tool doesn't really do a lot, to be honest with you. And you'd have to get psychiatrists that have followed these kids for a long period of time to see if, when the kid answered yes to these questions, long term, how did they do? Children and teens who are depressed enough to be considering suicide will almost certainly be showing signals. I'm so sorry about losing your brother. That is heartbreaking. My condolences, and very, very sad for you. But a very high percentage of kids and adults show signals. So if the teacher or employee of a school sees that there's something wrong, then the correct response is to call the parents. And there are some parents who don't care and won't do anything, but the vast majority will do something. For those students whose parents are not intervening, the school counselor should see the child and help them, as they've done for years. We don't make sweeping public policy based on the lowest common denominator. Hypothetically, suppose the schools began giving universal screenings for sexually transmitted diseases, or for testing all female students for pregnancy. After all, some students will get pregnant, some will have STDs, and they may not have parents who care enough to take them to the doctor. So the school could help by stepping in. Would we want our kids to be screened this way? What kind of message does this send to them? Schools are not health centers. They are educational centers that should be the focus. You may argue STD testing is a physical test and suicide screening is non-invasive. That is not a good analogy because the mental state of a child is of the most sensitive nature, and putting these results in an internal dossier could result in a misdiagnosis that could influence the rest of his life. Schools are and always will be ill-equipped to be mental health centers. That's not what they're designed for, and health screenings would infringe on parental rights. Schools must understand that kids are students to be taught, not patients to be treated. Parents are responsible for the rest of the child's care. The whole mental health push is an example of a common phenomenon in modern life. The government creates a problem and then argues it must swoop in, armed with more money and power, to fix the problem. Why are kids experiencing more depression and anxiety? Maybe because government policies have forced fathers out of families and God out of schools. Maybe because the government shut down kids' lives by shutting down their schools when there was zero justification for doing so. Maybe because government now pushes dogma that teaches kids to question their most fundamental realities, that they are boys or girls, that they live in a decent country, and that they have a bright future. The government can only make things worse. So I ask you to certainly follow what is best for children. My daughter, she's in 7th grade, 2017, she came home and said she took a survey at school, and the result was about what kind of career she might be best applicable for, and it was like a personality aptitude test. The school was mandatory. I didn't get an option to opt out or opt in. I just took it. I'm guessing there's probably a paper that got sent home in a backpack somewhere that maybe I could have opted out for, but I didn't see it. And this told my daughter that she fit her personality aligned most with an agricultural management specialist. I didn't know what that was. She didn't know what that was. We just kind of talked about it and laughed and like, well, we'll find out more about that if you get interested in it. A week later, she came home and told me that they lost her original survey results that she took. So they took her out of her math class and made her retake that survey to get the same answers that she had done before. She'd already gotten the results. So just a small little thing to say, my daughter missed a math class for a mandatory survey that was of no benefit. There are probably children that need help with careers and looking towards the future, but that's not most of our kids. Maybe 1%. The parents aren't working with what down the road can we kind of help you with. That's what that aptitude test was for. It wasn't for my daughter. It was for kids that need some help with that long term. So I think we take a big problem and we try to fix it with something that's not going to end up in the very end helping our children. Thank you for your time.
Thank you, Ms. Thompson, for your comments. Appreciate your time. We've got a couple more questions, but I'm going to defer those. If those that have questions would go speak to the author of the bill and work those out, that would be great. Again, this is hearing only, so we won't be taking action on House Bill 141 today. But I thank everyone for those in the audience, the committee. This is such an important subject to our children in the state, and would love to see us, again, kind of work toward a solution here. So with that, I will adjourn the subcommittee policy and kick off our next subcommittee meeting. Representative Ballard.
Okay, we're going to give everybody just a minute or two to get settled. We're running just a little bit behind, I know, but we're going to put a sign-in sheet at the table in just a second. Okay, I'm going to go ahead and call this meeting to order. This is the House Education Curriculum Subcommittee. I want to thank everybody for coming today, and thank you to the audience who is out there today. Today we are hearing HB 32, and we are working from LC 339311S. Is that correct? At this time, I'm going to ask the author of the bill, Representative Douglas, to come present.
Thank you, Madam Chair, committee members. Thank you for this opportunity. I am about to present House Bill 32, LC numbers 339311S. And I have a small bill, like always. All my bills are very small, less than a paragraph, but seems like it just has a lot of controversy, whatever I do, in that little one paragraph. So here we go. It's basically short and sweet. It's just a bill to have the championship game, not the playoffs, just the championship game, reviewed. I don't know how can I put this any clearer, just a review of the championship game. As we known over the years that the championship game has been a big issue. And so with that being said, it's just a bill to have the championship game in review and also have it being paid the same day. And that's the gist of the bill. It has to be in layman's terms for the how it's written. It's just basically instant replay and for it to be taken care of the same day or throughout the same payoff, the same, like they pay off the referees at the end of the tournament, and this should be paid off, and it shouldn't affect the local schools who doesn't have the money or wherewithal to take care of it. And that's the gist of the bill. Are there any questions?
Okay. Chairman Irwin, I recognize you.
Thank you, Madam Chairman. Representative, good bill. Appreciate this and the thought in light of the technology that we have today. We're talking about just football here. Am I correct?
Yes, sir.
Not other sports. This is the first focus is football, and it's only at the championship game.
Yes, sir.
And then I believe you mentioned also, if I can continue, Chairman, the funding, the billing and the paying for this is going to be done by the ticket receipts and in a fashion with Georgia High School overseeing that and that payment. Is that correct?
Yes, sir. I just wanted to, I didn't want, because some schools, we have rural schools and we have urban schools. The bigger schools would be able to add their monies to that because they have more money because the school is bigger. But I don't want to put the burden on the rural schools or the smaller schools that doesn't have the resources or the money to attribute to paying that in their final payment of the year. That's correct.
Okay, that's my question.
Thank you, Chairman. Representative Maynor.
Thank you. I just don't know, what is interscholastic sports events?
High school.
Okay.
High school sports. It's not. You don't get paid for it, so it's interscholastics. I don't know if that's correct definition. I don't have the layman's term definition, but high school. Oh, we have an attorney right here. So if he would weigh in.
Literally between schools, interscholastic. Okay. Yeah.
Representative Adana.
Thank you. I'm curious, what kind of technology will be used? I know there's a ton out there, and of course, that does impact the cost also.
Yes, sir. I wanted to make it where we always talk about local control, I didn't want to do a bill while I was doing local control. I wanted them to find out a way that best suits them to whoever they may choose. Doesn't matter to me. But the way I looked at it is when the weather was bad the last couple years, just to give you a little background, I didn't want to participate in going to the championship game because it was outside, it was cold, it was raining. And so it's being showed on TV anyway. And so actually the guys who commentate the game every year was making the calls that the officials should be making on the field. And so I wanted to bring it in the 21st century and to go a little bit deeper. It hit my heart when we were on ESPN, all right, nationally, and made mockery of for the state of Georgia. All my bills that I've created here since I've been here over a decade is to help the people of Georgia shine or bring us up to a different standard. And with this being the 21st century, we should be there. We're the #1 state to do business. We have the capabilities of doing this. And that's why I brought it forth. Thank you.
Thank you. Thank you, Madam Chair.
Vice Chairman Hilton.
Representative Dove, man, you had me running through a wall. That was awesome, that speech. And I think you may have answered my question in saying all that. Some folks will say, we're in process of doing this, we're about to do it, it's going to be in place in the future. How important is this bill that we get it done, put a mark in the ground, and say, we're doing it as a state?
I'm glad you asked the question, Mr. Chairman. Let me dig a little deeper for you guys, give you guys a little history. I've been on the Oversight Committee for Georgia High School Association since Senator Ellis Black was the chairman. I think he hadn't been down here, I think in the last 4 years, so I've been on this committee probably about 6 years. And we have run into a lot of things over the past that we had discussed mutually about getting done. And those things never get done. They were always planning to do them. And so in the planning stage, that thing can be kicked on down a few more years. Kicked on out a few more years, still in the planning stage. I don't mind you planning, but this bill was brought forth to help you plan that you're going to do it. And so there was a meeting earlier this year with the Georgia High School Association where this bill was discussed, like we're discussing today. Why couldn't something be done at that meeting just like it's doing at our meeting? And that's my whole gist about this. I'm tired of the planning. It's time to implement and get it done. And I would not be in my seat if I didn't get the phone calls from my constituent. And keep in mind, I'm an ex-football coach. I'm licensed in Georgia high school football. I've coached the last 20 years. I've coached at Grady High School. I've coached at Arlington Christian Academy. I've coached at Lovejoy High School. I've coached at Dutchtown High School. I've coached in this state, and I know what goes on. And so it's past time for this to happen with the technology. We're in the 21st century. Let's everybody move and just. I don't want to say this, but I think I'm gonna have to. Alabama already has it, guys. I'm tired of being behind Alabama. It's the Kirby Smart era. Go Dogs.
Representative Cox.
From one coach to another. You also played a little football too, which, by the way, the Dogs, thank you for that service.
Yes, sir. Thank you.
What I would like to ask is the past championship game, we had played a team known as Cedar Grove a few years back. Fantastic program. They do a great job with their athletes. And then watching the Sandy Creek Cedar Grove game, which I think is including, and we thank you, GHSA, for being here as well. We appreciate that. That particular deal, the referees who do a great job, GHSA is doing a great job as well. And I think this is nothing more than more accountability to make sure if I'm a referee, game's on the line, just like as a player, you may miss a call. And sometimes it's good to have a backup to support that. So my question to you as a coach, if you're on the end, if you're on the Sandy Creek end and it's instant replay and it's without a doubt the right call, do you have a problem with that call?
No, sir.
And if you're on Cedar Grove and you've had these kids, parents, community, all working really hard in an off season to get from point A to the finish line, and you see it taken, you learn a life lesson, but something just doesn't feel right about that. Have you experienced this in your own career of coaching or playing?
Yes, I have, on both sides, matter of fact. When I won it, it didn't really feel like a win. Does that make sense? I mean, you can play hard. I don't know if you guys play sports or anything in your life, or if you had a business and you went really hard at getting a contract or anything like that. And you got the contract, and then when you got the contract, you had to go through so much to get it. And you talk to yourself afterwards and say, was it really worth it? Was it really worth it? And then if you lose it on the losing side, of course, I want another opportunity. And like you said, these families, I'm a dad of all girls. Of course, they played soccer, and I was a soccer dad. I was at every game. I was on the road doing a lot. And most of those games came down to a call. And the more we got outside of the perimeter, the calls got worse, okay? And get inside the perimeter, you give your fair share. But I've been on both ends of that scenario, and it doesn't feel good on either end. And so and for the parents who not only taking their kids to practice, they went through the same thing that the kid went through, but some of the kids don't have an opportunity to do it again. You know, what about the seniors? They say, oh, we get them next year. But some of those kids don't have a next year. And this is the last game of some of these kids who won't have the privilege of going to play higher football at a state or university. That's their last time putting on a uniform. And for you to go out like that, to not have an opportunity of somebody else looking at it to say, okay, we made a mistake, let's get it right, and it's up to you guys on the field to make it happen. I think that's the gist of the whole bill, and thank you for your question. Thank you.
Our last question is from Representative Howard.
Thank you, Madam Chairman. You said we'll get them next year. That's what I said last night about Philadelphia. Question about the first one, I think Representative Cox alluded to this. Where would the accountability be on when we're talking about instant replay? Would it be with the referees? Would that be somebody else in the booth to be neutral to make those calls from the instant replay? That's my first question, and so you can just do both of them. Why is it exclusive to those schools that receive quality basic education funding?
Because we have a private system also. I'm going to ask the second one first because that's an easy one. We have a private system that doesn't participate in this anyway, in the Georgia High School Association. So it's a private school sector that doesn't have to, they don't do it anyway. So they don't have to come up under those rules. There are different rules for different sectors. And number one again, why was?
Where's the accountability?
Oh, accountability. I don't care how they set it up. There's normally somebody up top that's in the booth right next to the guys that's calling, guys or girls, that's calling the game. They can be in the same booth or the booth next door. Doesn't matter to me. They're probably going to be certified official that's probably retired. It doesn't matter to me. As long as they have officiated and have the background and wherewithal to make a decision. That's left totally up to who's ever putting this together. Thank you for your question.
Thank you, Representative Douglas. At this time, we're going to hear from Robin Hines from the GHSA.
Thank you, Madam Chair.
Thank you for having me. Representative Douglas, thank you for your passion, and go Dogs. And it doesn't matter
The thing about it is with video review, I would like to differentiate between instant replay and video review. We've got instant replay because we're on TV, and that's the play that plays again. Video review is when we look at some type of evaluation of a play that happened. So, even in the document that I'll provide you there, we've still got some of that language to clean up. And even though you have video review, that doesn't always mean that you're always going to get the call right. First, I'll start with the officials that work for the GHSA, even though they're independent contractors. They do an awesome, awesome, awesome job. I go back to when I was coaching a long time ago, that I learned to keep my mouth shut, because when I'd go back and look at the film, I found that our officials were right about 99.9% of the time, and I looked at them through my biased eyes. However, as we go forward through this, we want to make sure that we get every call right, especially when the technology exists. Even though that's not always going to be the case. Just like last night, there were some questions at the end about a call. My Dogs, when they lost the national championship to Alabama, now I'm telling you, we blocked the punt. They said we were offsides. We weren't offsides. And on the scoring touchdown over there, the wideout on the other side of the field was 3 steps down the field when the ball was snapped. So there's nothing that's going to guarantee everything. And I'm telling you, we need to do things to protect our officials and make sure that they're respected, because it's almost a pandemic on what's going on out there nationwide. All that being said, is we do not have a problem with video review. And I will say this is my 6th year as the executive director of the Georgia High School Association. There have been 2 such questionable calls in football finals, 2. One 6 years ago, and then one right there. Okay, one would have been turned over, which is the Cedar Grove game. There's no question that it would have gone over. In 6 years, there's another one. If it were reviewed, it would have stood as it was. But that's neither here nor there. We still want to get every call right. So once that Cedar Grove game happened, what should have happened, it should have been 4th down from just inside the 1. Okay, that's what it should have been. But it was not. And before the end of the night, I had already contacted our Board of Trustees to put a meeting together to talk about video review. And we had already agreed in principle to do so. The first available date after the holidays, we got together and the Board of Trustees voted 13-0 to implement video review. And we've put together at that time, and I'm happy to pass these out. This is a draft of what we've put together and worked really hard at it. Video review is a difficult thing. You got to decide who's going to do it, what operationally it's going to be, what plays are there. You don't want to extend the games and all that, and that kind of gives us an idea of where we are. But anyway, the Board of Trustees voted to do this. It's already a decided issue. It'll be approved at the April 17th meeting. I've not talked to any official or any member school who is opposed to this at this time. And the time is now, and what we want to do is where the technology exists and where we have the ability to do that, we want to do that. We've just agreed to 3 years in the Mercedes-Benz Stadium, which, again, of course, I will say this, that I have had the good fortune of being snowed out of an indoor facility before, but it's nice to not have to worry about weather, quite as much, and worry about a bad forecast, keeping your fans away and those sorts of things. But we certainly have the opportunity to do it there, and wherever we have, and for the foreseeable future, of course, Rich McKay and I, as we're going through the talks, he wants it there in perpetuity, and we would like to see that happen as well. So, the bottom line is, we're going to have video review. That decision was made really back in December. It was confirmed by the Board of Trustees on January the 11th, and we're in the process of cleaning up the language there, and that's what will be presented to the full committee, which I totally expect to pass unanimously without any problem whatever. And officials are certainly for that. I hadn't heard anybody who is adversely done it. It protects officials as well. I'll take any questions.
Thank you so much. I believe we have a question from Representative Maynor.
Thank you. 2 questions. Are there any high schools that participate in football games of sorts that are not under GHSA?
Yes.
And so would that mean that HB 32 is, and then are they QBE? I should have said.
No, they're private schools, and they are not subject to this.
So are there any QBE schools that are not under GHSA?
No.
Okay. And then the other question, I don't remember the exact name of the oversight committee that the representative is on. Did GHSA and that oversight committee work together on this?
No.
And the, I guess, last question, if I can. One more. Okay, is would GHSA be amenable to the oversight committee giving any suggestions?
I don't have any problem with that.
Okay, any further discussion from the committee? Hearing none, at this time I'll entertain a motion.
Madam Chair, the appropriate time will make a motion. Do pass.
Is there a second? HB, okay. HB 32 has a motion and a second. Any further discussion? Hearing none, shall this bill now pass? All those in favor say aye. Aye. All opposed, like sign. Motion passes.
Madam Chair, can I
Yes.
make a statement?
Oh, no.
Demetrius, do you mind Representative, would you step back up there for a second?
Yes, sir.
In light of what Georgia High School just stated in your bill, when I see instant replay, video review, would you entertain correcting that terminology, I'd say, before this goes to full committee?
Absolutely. I'm amenable to anything working together, as long as we get it done together.
Mm-hmm. But, you know, again, at least my ask of you is to look at the terminology so that it lines up with what Georgia High School's doing in any fashion. So,
Yes, sir.
Thank you.
So if there's no further business and no objection, the meeting will be adjourned. Meeting adjourned. Yay.